and welcome. We're delighted to be able to share information with you this evening about 6 diagnostic and advanced training programs offered by BCIT School of Health Sciences. As you know, we'll be starting in this room for some presentations, and we'll move up to the town hall rooms where you'll be able to talk directly with the speakers to have your questions answered. So if you do have questions, please save them and bring them up to the room across the hall. I'm Craig Larson. I'm the Associate Dean in the School of Health Sciences at BCIT. And my co-hosts for this evening's showcase are Cindy Mazzarol. She's Program Head in the Cardiac Sciences Program. Domenico Celli is Program Head in the MRI and Medical Imaging Bachelor of Science degree program. Denise Pelzer is Program Head in the Medical Radiography, also known as X-ray program. Joe Cortez is an instructor in the Nuclear Medicine program. Lorraine Clark-Rowe is Program Head for Radiation Therapy. Nancy Schwinnard is Program Head for Sonography, also known as Ultrasound. And at the end there is Ambreen Sharif is the Program Advisor. All of our speakers will be in the rooms across the hall for you to talk with after our sessions in this room. So let's start out by asking, so why choose BCIT? You can be assured that you'll be job ready at graduation. BCIT has a proven track record for providing a perfect balance between theoretical teaching, laboratory experience, and hands-on clinical experience. All of our programs have a cohort-based plan where clusters of 10 to 20 students move through the learning process together. So the students will learn not only from their instructors and clinical leaders, but also from each other. BCIT has an amazing lineup of support services for students, and you'll hear more about that from Ambreen in a few minutes. BCIT has a very well-qualified faculty. Most of our faculty are not only educators here at BCIT, but also practicing professionals in BC's leading-edge healthcare institutions. All of BCIT's health programs, are accredited in Canada. This means that your credentials will be recognized and respected anywhere in Canada and in many of the programs internationally. So choose BCIT for an excellent launch to an excellent career. But what will you need to get admitted to one of our programs? I'll give you a high-level overview. The program speakers and advisor will give you further details as we go along. You'll need to be strong in high school sciences. Some of our programs may require a post-secondary certificate or degree. Relevant volunteer or work experience will strengthen your application. And you should research the profession you'd like to go into. Have a good understanding of what the job would entail. If you're successful in getting shortlisted from the full list of applicants, you'll then be required to participate in a so-called multi-mini interview with members of the program. You should also know that our clinical site partners all require you to have a current CPR certificate that has to be refreshed every year. You have to have up-to-date immunizations, a criminal record check if you're going to be working with children or other vulnerable populations during the clinical rotations, and you'll need to buy an N95 fit mask. And I don't know what that is, but somebody here can tell you. So why consider medical diagnostics as a career track? Diagnostic and advanced treatment services are patient-focused, and they're best served by people who care about people. These areas of work give you an opportunity to merge both advanced technical skills and people and patient skills. The jobs you'd be going into are fast-paced, they're exciting, and they're dynamic working environments. And you'll have options in terms of work settings. Maybe you want to work in a hospital, maybe you want to be in a clinic, and maybe you want to eventually be in an educational institution such as BCIT. The program speakers will explain this further as well. Now be aware, however, that working in healthcare often means shift work. It's not always going to be Monday to Friday, 9 to 5. Sometimes it is, but more often than not it isn't, at least not to start with. On the other hand, you're going to have great opportunities for continued career growth into research, into management, into policy development, or advanced practice in your field. You'll have many, many choices. What will it take for you to be successful in one of our programs? You'll need to be proficient in English, both written and oral language skills, and be a really good listener both to your instructors but to the patients. You'll need to be in excellent physical health. In many of our professions, you're going to have to help lift and position patients. You'll need good mental and emotional health too. Illness is almost always a sad and stressful event in a patient's life, and you'll encounter from some very difficult situations. You're going to have to be able to cope well. You're also going to need time and stress management skills, strong decision-making and problem-solving skills, initiative, teamwork, and interpersonal skills, computer literacy, strong 3D visualization, manual dexterity, and really good hand-eye coordination skills. And again, our speakers will explain some of those needs as we go along. Now, with regard to program timelines, please note that the 2018 application window opens on November the 1st for September intakes. Each program has its own deadline. Be sure to make yourself aware of the deadlines, and you'll see on the screens the deadlines there. And with that, I'd like to hand the mic over to Cindy Mazereau. Thank you.
Hello, welcome. Ooh, it's gonna get your heart rate going there with my voice. Okay, wake up. So cardiac sciences, I'm gonna tell you about. We have a portfolio of 5 different programs, 4 of which I'm gonna talk about today and meet you in the other room to talk about. The first one is our base program, which is a cardiology technology diploma program. And they do non-invasive procedures like electrocardiogram, the ECG, the Holter monitor, and the exercise stress testing. They help diagnose and care for patients with heart disease. And they work directly with patients. I think we've all known somebody with heart disease in our family or close friends. And they also get to use the sophisticated diagnostic technologies that keep changing and are new in our field of cardiac sciences. The diploma can be as small as 2 years in duration or as long as 5 years. And it's made up of multiple terms. We offer courses in September, in January, in the winter, and in spring. And then you have the summer off in our programs. It's a blended program delivery, so online theory courses in a D2L distributed learning environment where you're learning online, you're interacting with your peers, you're interacting with other instructors. So lots of flexibility there with some structure in terms of how long you take to finish each course and some of the assignments and things that are expected of you during those 12 weeks. It's also complemented by a 2-week on-site lab that gets you ready for your first 10-week clinical. And in that lab, you get to use the equipment, you get to meet your peers, you get to do hands-on, you get to work in the simulation lab. We have a nursing simulation lab here, and all the technologies work in there together. So then you move on to your 10-week first clinical, and then back into the theory online courses, followed by your final 17-week clinical. Our clinical sites are across Canada, and it's a total of 26 weeks with the first and the second clinical, and we have clinical sites in every province. So that's nice, because if you live in Alberta, those of you that have joined us online, you live in Nova Scotia, you can stay in your home province. Our advanced courses are, you receive an advanced certificate in cardiac sciences, and you have 3 different options. So you have our cardiac rhythm device technology, also known as pacemakers. You have your cardiovascular technology in the cath lab, and the electrophysiology program. Now, these advanced programs are after you have at least 2 years of clinical experience. So after you've worked in the cardiac area, or you're a nurse or another practitioner working in and out and around cardiac, you can take one of these programs. They're also available part-time, distance and online, and have a variety of clinical experiences across Canada, and takes an average of 1.5 to 2 years to complete. The job opportunities for cardiology technologists are in hospitals and clinics across the country. Right now in BC, you'd probably end up working part-time. So right after graduation, you'd work casual for about a year before you'd find a full-time position. Some other provinces across the country have a lot of employment opportunities, so there's definitely that opportunity to look at. The wages range from 25 to 29 for the base cardiology technologist, and approximately 28 to 34 for the advanced certificates. And that can go as high as $50 an hour if you're working in industry. Any critical care nurses with advanced cardiac certificates through us will earn $8 to $10 more per hour. That's usually based on their collective agreement of hospitals and their nursing degree. You have other career options, as Craig mentioned, to work in clinical applications for medical equipment companies, and also in research or here at BCIT. And now I'm going to hand the mic over. We're going to talk about magnetic resonance imaging.
Hello, I hope you can hear me okay. I have a cold, so my voice is not going to carry very well. But if you have trouble hearing me, let me know. I'll try to speak up. My name is Domenico Celli. I'm the program head for the MRI program, certificate program, and the Bachelor of Health Sciences with the MRI option. What is MRI? MRI stands for magnetic resonance imaging. It's a very high-tech type of medical imaging, one of the newer ones and constantly evolving. MRI uses very powerful magnetic fields and radio waves to create images. And because of that, there's no ionizing radiation, so patients are able to have as many MRI scans as needed without any concern about radiation. And so it provides a non-invasive diagnostic test for any medical condition you can think of, any part of the body. So we can do everything from brain to heart, vascular imaging. There's no area of medical imaging that MRI doesn't touch in some way. Our program is a post-diploma program, so what that means is that you already have to be a medical imaging technologist before you can take our program. So you have to be one of the modalities that my colleagues will talk to you about. So you have to graduate from that before you can apply into our program. So the other thing about our program is that it's totally online, so you never have to come to BCIT. So if you're already working as a medical imaging technologist, you can continue to work while you're doing our program. The only thing you have to do is take a 4-month leave to do a practicum in one of our clinical partner sites, and we'll help you with that, finding a site for your practicum. So the other part of this program is the degree program. It's called the Bachelor of Health Science and Medical Imaging. So this is combined with the MRI program. So if you do our MRI program, then you're also eligible to do the Bachelor of Health Sciences and Medical Imaging. So you can continue on, and we'll give you full credit for the MRI program. And then you do like 7 more courses, 21 credits, and you get your degree. And all those courses are also online, so you never have to come to BCIT as well. As far as job opportunities for our program, job opportunities for MRI are huge, and they're growing by the day. Even as I looked today at the Lower Mainland, they had 14 positions posted just today. So there's lots of opportunity, both in the public and private area. So you can work in hospitals, or you can work in a clinic that has an MRI scanner. And the wages range from about $33 to $38 an hour at the hospitals, depending on your years of experience, plus benefits. In the clinics, they tend to be higher, up around $41, $42 an hour, but the benefits are usually not quite as good. All right, so I'll pass it on to the radiography program head, Denise Pulitzer.
Good evening, everyone. So my name is Denise Pelzer. I'm the program head for medical radiography. So why medical radiography? First of all, what is medical radiography? Our radiological technologists take images of body parts or body systems and using equipment that produce X-rays. Is it a safe profession? Yes, it is. We teach our students about radiation safety. Our equipment and the industry complies to industry standards regarding that. So we teach our students how to minimize dose to the patients by keeping their light fields down as small as possible and only imaging parts that are necessary or required for the test. We also teach our students and the graduating technologists to protect themselves, protect other healthcare workers, and protect the public at large. So what type of experiences we have in our profession? We do all types of experiences depending on the equipment that is available to us. So we take general x-rays. We can do those in the x-ray department. We have mobile equipment, so we can go out to the patient's bedside. That also allows us to go into the OR and work with surgeons. We do a lot of orthopedic work with the surgeons. If a patient has broken a bone, sometimes it can be put in a cast, but sometimes they have to go have surgery. So we go in with the surgeon as they're implementing the instruments, and we are part of that procedure. We can take static images. We also have equipment that does dynamic x-ray, and that's called fluoroscopy. So we can do all sorts of imaging with the surgeons and with the radiologists as well. We do cases where we can provide our patients with some lovely stuff to drink called barium. And so what we do is give the patient the barium, and as they swallow, we can actually watch them swallow this lovely mixture. We watch it go into their stomach and move through their digestive system, so we can actually watch things as they happen. We do a lot of static imaging as well. We go to the ER, whether, again, a patient is too ill to come to us, or if there is a trauma situation. So if there's been a motor vehicle accident and the patient has been injured and can't come to the department, again, we're part of that trauma team, and we're told when to step in and take x-rays. So we get to have huge varieties of experiences. The big one right now is the CT scanning. So, other modalities do CT as well. Again, it does produce radiation, and what it does is actually take a slice through the patient's body, and actually you look up into the relationships of the organs and the organ systems within that slice. Using this equipment and the computer, because it's all off of computer, we can actually reformat our images and do 3D rendering. So we can actually take the kidneys and the ureter and the bladder, and it would just demonstrate it free-formed in 3D, so you can rotate around. It's very, very intriguing. It's a really fast-paced and challenging experience. Patients come in and they get busy, lots of patients, and so we're always trying to make sure that we're being as fast and efficient as possible to make sure that our patients aren't waiting in our waiting rooms too long. Every case that comes in is different. Every patient history is different, so we have a lot of great experiences with our patients, and no day seems to ever be the same. Our profession is a mix of technical abilities and patient care. So we work a lot with computers, but a big part of our profession is patient care. So a lot of hands-on with the patients. We like to make sure that we're empathetic, and we like to make sure that we have lovely conversations with them so that they're not feeling that they're not important to what we're doing. An overview of our program: we are a diploma program. We have 24 continuous months, and I do mean continuous, so there's no summer breaks off. We do have short-term breaks in between each term. We start off with theory, a term of theory. We give you a lot of information, and then we send you off to clinical. The first summer term that you come to is actually an online term, so you can do that term anywhere. You can get stable internet access, and that you can get proctors to invigilate your exams. And then you're back out to clinical, different site this time, so you're getting a wide variety of experiences out in clinical. And then you come back to BCIT for the last theory term, and then back out to clinical one last time to hone your skills and come out at the end of the program. So again, program is 24 continuous months, and then you access the CMRT certification exam for that profession. We have a variety of educational methodologies that we use. So in the first term, you will experience courses that are face-to-face lectures. Some of the courses have face-to-face lectures. They also have hands-on application labs and some online content. So we have a wide variety of modalities for all types of learners. What else can I say? So we have 18 clinical sites throughout the Lower Mainland and includes the interior and in the Kootenays. We do use a computer program to actually place our students. They are provided the opportunity to input their selection, and then we let the computer program do the rest. So our students are placed all over through those sites. Job opportunities. Job opportunities for our graduates. When you graduate, you come out and there's plenty, or not plenty, but there are casual jobs out there. Many of our graduates work at several sites as casuals, building seniority until the part-time or more permanent jobs come up. And again, moving out of the Lower Mainland, there are more opportunities for more permanent work. But again, as the students move in to these areas, they do find stability, and they do eventually come into permanent jobs. Our graduates are also employable at many of the private clinics in the Lower Mainland. Laddering opportunities for our graduates. So our graduates can ladder into the MRI program, both the certificate program and the Bachelor of Health Sciences degree program, as mentioned by Domenico. And our salaries start at approximately $26 an hour, and it really depends on the area that you're working in or the shift that you're working in as to how high your salary can go. Many employees or technologists work their way through the field up into management positions. And so now I'm just going to hand it over to Joe Cortez from Nuclear Medicine.
So a lot of people haven't heard about nuclear medicine or don't know what nuclear medicine actually is. Nuclear medicine basically uses a biological tracer combined with radioactive materials to produce images that help diagnose and manage disease. So the way we work, we take a small, safe radioactive sample and we inject it into our patients. So that safe amount is safe to the technologists that are working with this. It's also safe for the patients that are receiving it. Where X-ray takes radiation and passes it through people, nuclear medicine puts the radiation into somebody and gives it a bit of time to localize. And where that radiation localizes is where you have higher metabolic activity, where things are going on inside the body. So nuclear medicine is a type of imaging called functional imaging. It looks less at where things are and the anatomy and more at where things are happening and where things are taking place inside the body. So another part of the profession is creating the doses. So you're actually taking these radioactive materials, binding them to a material in a lab, and preparing those for injection. A lot of analysis of the scans, so they're looking at the scans to interpret them. There are also therapies involved in nuclear medicine. So if there is a process in the body that could be treated with a radioactive material, they will inject a radioactive material that localizes inside a part of the body, and the radiation there is intended to damage that part of the body and treat whatever issue they're dealing with. A lot of patient explanations as well. So there's a lot of one-on-one interaction with your patients and making sure your patient is comfortable, feeling safe, and understands what's happening to them. As far as the program overview goes, this is a diploma program, and again, we're a continuous 24-month program, just like X-ray. We don't have a lot of breaks. So you start in September, you finish at the end of August 2 years later, and Christmas, a week here or there, but a very, very solid, intense program. We take in 16 students per year, and at BCIT, we get the theoretical information. So the first year, basically September to May, you're in classes. learning the theoretical information. In the first summertime, you have a clinical rotation within a hospital. In the second year, from September to May again, you have 2 weeks at BCIT in the classroom, 2 weeks in the hospital, and that rotates through the second year. And then in the last summer, you're in a different hospital again. So there's a total of 40 clinical weeks, and you get, in addition to those 4 clinical sites, 2-week specialty rotations. So you'll get 2 weeks at Children's Hospital, getting to work with kids. You get 2 weeks at a PET facility. PET stands for positron emission tomography, and it's a slightly different type of nuclear medicine. They do those types of scans at the BC cancer agencies right now. And you get a 2-week rotation in a CT, working with a CT. The program may require you to travel for your summer clinical rotations, so you have to be willing to be on the move for the summer if that's possible. And the program requires you to inject materials into patients. So you have to be comfortable with needles. You have to be comfortable getting quite close and intimate with a patient when you're in that process. You need the manual dexterity to actually find a vein and inject and make that a successful operation. For the job opportunities, salaries generally range from $28 to $35 per hour. Graduates are employed primarily in hospitals within BC. There are other career opportunities. There are clinical applications where basically you can work for the companies that are either providing the radiopharmaceuticals or the special cameras that take the images of these patients and do a lot of work for them. There's research and development. One nice thing about the job prospects for this profession is it is basically a Monday to Friday, 8 a.m. to 5 p.m. job. Some of the shifts start a bit earlier. You will not get a full-time position right away if you want to stay in the Lower Mainland. So you will be working casually at a number of different hospitals for a number of years before a permanent position comes up. Field is growing in BC. There's a number of new installations of these types of departments. Penticton Hospital is getting a new nuclear medicine department. The hospital in Comox is doubling in size. There's a number of PET scanners that are being installed at the BC cancer agencies. So in Kelowna and on Vancouver Island, there's going to be a number of different positions opening up as well. If you have any further questions, please come into the room and visit us at the nuclear medicine booth. We brought a couple of students if you'd like to ask them some questions. And I'm going to pass the mic along to Lorraine Clark-Rowe from Radiation Therapy. Thank you.
Hello. So I'm Lorraine. I'm the program head for radiation therapy. And I just will fill you in a bit as the others have. So radiation therapists treat cancer patients. Almost exclusively, we deal with cancer patients. And we use focused beams of radiation to destroy the cancerous tumors while minimizing harm to healthy tissues. Our main responsibilities include imaging patients to establish the target area, which is the tumor, and plan optimal treatment. We utilize ionizing radiation sources and advanced technologies to deliver the treatment to the patient on a daily basis. We interpret patient setup instructions, radiation beam descriptions, and dose calculations, and we ensure patient safety and quality care delivery. The radiation therapy program at BCIT is the only program in British Columbia where you can train to be a radiation therapist. It is a degree, it's a Bachelor of Science. The entrance requirement is a minimum of 1 year post-secondary education with specific courses that are identified, such as physics, math, and English. And then you come into the program for almost 3 years to complete the degree requirement. We have a small class size. Typically, our intake is 12 students per year, and it offers a very personalized setting for learning. Our program focuses on curriculum with respects to radiation therapy practice, but we also do research, and we have some aspects of leadership development in the program. We utilize a variety of teaching and learning methods, including blended theory or academic study, simulation, and clinical experience. We have a total of 49 weeks of clinical placement at the we don't use all 6. We use 4 clinical sites in the province where you then practice hands-on and work in the team with other radiation therapists, radiation oncologists, medical physicists, nutritionists, and other allied health professionals. With respects to job opportunities, a full-time salary starts at approximately $58,000 per year, but as mentioned by the other programs, our graduates start in casual positions and work their way into the more permanent full-time positions. In British Columbia, the cancer centers are under one umbrella called the BC Cancer Agency, and there are 6 centers in the province. There's Prince George, Vancouver Island, Victoria, Surrey, Abbotsford, Vancouver, and Kelowna. That's the 6th one. Once you've graduated from the program and you write the national exam to become certified, you can work anywhere in Canada, so any province. And some of our graduates have worked overseas. You can work with the Canadian credential, you can work in the UK, Australia, and so forth. So if you have any other questions, we're happy to chat with you at the tables out in the town square after this panel session. Thank you.
Am I live now? I'm Nancy Chouinard. I'm the program head for sonography, or ultrasound as it's often called. If any one of you have ever watched a medical drama on TV, I'm sure you're familiar with ultrasound. But ultrasound uses high frequency sound waves to produce the diagnoses. It's basically just a really high-tech fish finder. And it's probably most familiar to you and most famous for all the obstetrical work, including some of the really cute 3D baby face pictures that come out. But it encompasses so many parts of the body, and so we certainly do fetal scans, but we also look at the abdominal organs, pelvis, blood vessels, muscles, and the heart. So basically, if it's not made of bone or full of air, we can scan it. So, and each case really is very unique. We always teach our students that there really is no such thing as a normal exam or a standard exam in ultrasound. Everything is, so it's really dynamic and very interesting. All of our imaging is real time. We watch it happening and we actually make it happen. We hold the probes in our hands and we do the scanning. It requires a lot of problem solving from a diagnostic point of view because we make the decisions about the images that we choose to record. There's a roadmap that we follow, but we decide what we need to record, so we do need a lot of pathology knowledge. One of the favorite things about sonography to sonographers is that it has a lot of one-on-one patient time. We typically will spend about 15 to 60 minutes with the patient during an exam, one-on-one in the room, and that's a long time. You can actually develop quite a relationship with the patient, and the practitioners really enjoy that one-on-one. And you get a chance to speak with them and learn more about them. But it can be emotionally demanding. It's very rewarding, but can be very demanding, and you require very good communication skills because it is one-on-one, and they're watching you the whole time you're doing the study. And they ask lots of questions. So it makes it really rewarding and fun, but it can be very stressful as well. So you have to be prepared for that. It also requires a high degree of manual dexterity. We always say that sonography is really an art as well as a science. It's kind of like what you may understand how a piano works, but you have to practice and develop the ability to be able to play the piano, and sonography is very much like that. In terms of our program overview, it's a diploma program, and it is 27 months in total length, but we do have breaks, yes. So you get about 6 weeks off each summer, and in the first 3 terms, it's primarily classes and laboratory. And so in the scanning lab, you will be you'll actually scan each other. So you'll be a patient sometimes, you'll be a sonographer sometimes, and so you get to scan each other and do live scanning. And you'll have the opportunity to practice pretty well all the types of ultrasound that we do, except for obstetrics. But we do actually have an obstetrical simulator in the lab as well, so you'll have the opportunity to do some obstetrical work as well. There are 32 students per year, and it's a cohort model. And so the whole final year of the program is out in clinical. And during the clinical time, you'll go through about 7 different rotations, and you expect to be in a placement outside of the Lower Mainland for probably between 13 and 20 weeks of that time. And although some students didn't think they wanted to move outside of the Lower Mainland, those experiences are often really rewarding, and you'll be traveling to all different parts of the province. And you go to different, I think at least 7 sites for most students, and it gives you an opportunity to experience a wide variety of practice types and patient types. So it's a very interesting program, but it's busy. The graduates of the program are actually eligible to write both the cardiac sonography and general sonography exams and obtain those credentials. So you're very broadly trained at this time. The job opportunities are good in sonography. The salaries range about $30 to $37 an hour in the hospitals, and as Domenico said, sometimes a bit higher in the private clinics. And there are career options available. You can certainly work as a general sonographer or a cardiac sonographer, or there are a number of departments across the province where you can do both. Or you can work in a hospital or in a clinic. The clinics currently don't do vascular or cardiac studies, so you're more limited in the variety, but there's a variety of different environments that you could work in as a clinical sonographer. There are also opportunities in clinical applications for the companies, and some opportunity for research and development with the companies or in a clinical environment. And you can also teach. With some experience, you can teach. You can certainly teach in the clinical environment as a clinical instructor. And I was thinking about our faculty, and of our 13 faculty members, 11 of them came to BCIT for the program, so that's pretty impressive. There are very good opportunities for employment. There are shortages of sonographers across the province, so that's the good news. The challenge of that is we're very, very popular. And so we have a very large number of applicants for the program every year. So although the prerequisites seem fairly modest, they're typically high school prerequisites, because it is such a competitive program, I really urge you to spend some time looking at the website to find some of the recommendations for, there's a description of what a successful applicant background typically is, and ways that you could strengthen your application to be a successful applicant to the program. And I and a couple of my colleagues and a couple of students will be in the town square room next door, and we'd be happy to answer questions afterwards about that. But getting that information, program advising, can be incredibly helpful. So with that, I'm going to hand this over to Ambreen Sharif, who will give you some information about program advising.
And now we'll be administering a test on all that information. Just kidding. So that's kind of where we come in. My name's Ambreen. I'm with BCIT's Program Advising Department. We're located across from the registration office in the main gateway building. And I'm accompanied tonight by my colleague Maninder Desi, who is handling the online component of this session. So as advisors, we're able to kind of break it down for you a little bit, give you specific information about program outcomes, so the nature of work and employment outcomes for our previous grads. That's a common question we get. As well, we can walk you through entrance requirements. So all programs will have their own specific entrance requirements, required grades, etc. And one of the common questions we get is about upgrading options. So if you need to upgrade requirements, what are your options? We have courses that we offer, refresher courses we offer through BCIT, as well as challenge exams that can be done. And there are also options to upgrade outside of BCIT by attending adult education centers or taking equivalent courses through other post-secondary institutions. So one of the common things that we address with prospective students is how to strengthen an application. So we have information about what the specific programs are looking for, what their preferences are, and are able to kind of give you an idea based on your background what you need to do to strengthen your application and improve your chances of being admitted. As well, we can just break down the application process for you, explain what documents need to be submitted and when. Obviously, each of the programs have their own specific deadline dates to apply, and as well, we get questions about the cost of programs and transfer credit. Because our programs are quite technical in nature and focused on giving you the skills for the job, often transfer credit is not as much of a possibility because unless you've taken something that covers very similar content previously. But we do get some more general courses that do transfer into our programs, so we can kind of give you an idea what the process would be for that. As far as the application process is concerned, what do you need to do? So the first thing that we suggest you do is review the entrance requirements, because they can vary by program, and check the specific deadline date. As Craig mentioned at the beginning, for programs starting in September, we start accepting applications November 1st of the previous year until the deadline date. We also recommend that you check the preferences, which are listed above the entrance requirements. Often with these programs being competitive, they're looking for additional post-secondary education as an asset. Patient care experience can be beneficial, specifically experience in a healthcare environment, volunteer work in a hospital or clinical setting, or in a nursing home, for instance. Also, some programs prefer 5-year recency in some of the requirements, and obviously good academic grades. As far as submitting official transcripts, you'll want to submit them in PDF form. We have a fully online process for applications now. So you'd be submitting from the program webpage. If you scroll down under the entrance requirements, there's an Apply Now tab. Click on that and scan and attach your official documents as PDF files with your online application. That's generally speaking high school, post-secondary transcripts, as well as a mandatory applicant questionnaire is often one of the documents you'll be asked to submit, which would then be giving you standardized questions about your work and volunteer background, any relevant experience you have. So, the Apply Now tab is in the program entry section under the entrance requirements. As far as the application process is concerned, first off, when you apply, admissions will receive your documents and they'll review them for the academic requirements to make sure that you have everything met in terms of the academic requirements and the grades. And you'll receive correspondence through your My BCIT email account. And then come the deadline, the qualified applicants, their applications are sent to the program area, at which point there's then that competitive selection process. Once applicants are shortlisted, there's a multiple mini-interview process, which is actually common for 3 of these programs. So they have a common multiple mini-interview for sonography, radiography, and nuclear medicine. And after the interviews, decisions are made and applicants are informed. So this can take several weeks after the deadline date. With a common multiple mini-interview for those 3 programs, there's also the possibility of cross-recruitment across programs if you're not accepted for a specific program. So the thing to note is it's not first come, first served for these programs. It's apply by a deadline and then go through that competitive selection process. It's the strength of the application that matters, not how early you apply. So you can be applying right up to the deadline date, but you just want to make sure that you get your strongest application in. BCIT offers many different services for students, including counseling services. We also try to encourage a balanced lifestyle for students despite these programs that don't have breaks. And so we have a really great rec services with a newly refurbished fitness facility and fitness classes that we offer. We also have a big student association which advocates on behalf of students and offers many resources including career services. To learn more about BCIT student life, we have a lot of different resources, which we didn't have back in the day when I went to university. So do take a look at the student blogs, bcit.ca/mylife, and specifically the YouTube videos are great, just to give you a really realistic view of our programs and also program outcomes. As far as program advising services, we have 3 main services. You can contact us by email at program_advising@bcit.ca. Each of our program web pages also has a contact us link, so you can just click that and send us an email, and we get back to you within about 3 business days. We also have a live call service that we offer, and I noticed a slight error there. It's not Monday to Friday, it's Monday, Tuesday, Thursday, Friday. Between 8:30 and noon, we have a live call service, so you can just phone in and speak with one of us in person over the phone. And then we have drop-in sessions as well. So we have about 10 to 15-minute drop-ins that you can come in for 3 times a week, Tuesday and Thursday afternoons and Wednesday mornings, to see one of us in person in our offices. You can view all of these services, including holiday hours, at bcit.ca/advising. So that's about all I have. Maninder and I will be at the Town Square A and B as well, and at this point we'd like to ask everybody to take a breath and then move on to Town Square A and B, and we'll be happy to answer your questions in person. Thanks.